Hi guys, welcome to the next episode of the Clinical Coder YouTube channel. Sorry about the constant beeping, that is our security system in the pharmacy. As I'm sure you guys probably can't tell, or maybe can tell, I'm actually recording this in our lovely lighted methadone hatch. So we have a tiny little room where patients can come and get their supervised consumption, and this is where I'm filming right now. So you may hear the security alarm go on and off, but I hope it doesn't distract too much from what we're going to talk about today. So AI, artificial intelligence, it has taken the world by a storm, and not just the world, but it's taken different verticals, and by verticals I mean different subject areas. So we're talking about aerospace, finance, business and healthcare, of course. And obviously with healthcare, it's a highly regulated environment, just kind of like the financial environment. In healthcare, you know, there is a lot to think about when talking about AI. So kind of rather than me rambling on, let's just get straight into it. So first of all, what is AI? And I'm sure you guys have heard this definition so many times, but AI is generally a computer mimicking human behavior and the way that we would process data, but obviously in a arena that is multitude and exponentially taking in those data sets to kind of process that data and give us information that we want to hear. So let's talk about where AI is currently being used in healthcare. There are so many ways and places where AI is currently being used. One notably, a few weeks ago, NHS England released some guidance around the usage of AI scribes. Now, what is an AI scribe? Essentially, what it is when you're a clinician and you're doing your consultation, the AI scribe will listen to what you're saying, what the patient is saying, and effectively summarize those notes to give you the key pieces of information that you need, that you can then transcribe to the patient's electronic health record. Why is this great? Why was this a problem to solve? Well, there has been a lot of evidence to suggest that clinicians, doctors, pharmacists, nurses, any healthcare practitioner generally spends more time behind a computer rather than actually doing their clinical practice. So, you know, talking and asking questions to a patient while furiously typing or clicking drop down menus or trying to find out where the bloods are, all of that kind of thing, rather than focusing on actually what the patient needs and that bedside manner. So the AI scribes are supposed to be able to remove the doctor or the clinician away from the desk so that they can support their patient and show all those skills that we have all learned during our university years about bedside manner. And there are some really great scribing tools out there. I definitely highly recommend that you go and have a look out and start to try them in your clinical practice. And there are some really great founders developing these tools as well. Now, moving on from scribing tools, AI is also being used in the operational sense. So when you're working in a large organisation like a hospital, there can be things, you know, there are so many moving parts. So for example, you know, you get an appointment letter in the post and say you can't have that appointment because you've got childcare or you've got something else. Now, AI is being utilising, taking that data to really understand what would be the best and most effective time for that person to have an appointment, knowing if they've got caring responsibilities, knowing what time they would be free, knowing what type of appointment and how long they need. All of that information can then be put through a model to then spit out the best appointment for that person. Why is that important? Because it will provide the most successful rate for that person to show up to the appointment and not cost the hospital or the healthcare system the price or cost, I should say, of that missed appointment. So that is also where AI is being used in healthcare. And then we can start to move on to more kind of, I guess, visionary things. So things like using artificial intelligent robots to support surgeons doing surgery, or using VR or AR to kind of train healthcare professionals in their arena. There are some really cool places where AI is being used. Of course, if you guys know any, please comment, drop down below in the comments. I'd love to hear if you come across any, and it'd be great to kind of like share this information to really understand where these tools are being used. The last part I kind of wanted to discuss in this video was the regulation side of utilising AI in healthcare. Obviously, as I mentioned earlier, healthcare is highly regulated, and there is a regulation stream called software as a medical device and AI as a medical device. So if these tools are being used as medical devices, and what I'll do is I'll pop down the definition of a medical device down below. It is very distinctive, and essentially if these tools are being used as a medical device, they then need to go through the appropriate regulatory channels. At the moment in the UK, we're still trying to iron out clear guidance on what constitutes as a medical device, but also what we should be able to see when AI is being utilised in this manner. So when I say that, I mean kind of things like, you know, do we know why it comes out with the outputs it comes out with? Can we clearly see how it's come to the conclusion it has? AI tends to have a component called hallucination, and hallucinating means that it kind of spits out something you didn't think it was going to come out with. And some AI models do have the tendency to do that. So this is kind of about mitigating that risk and understanding if it can hallucinate, how do we reduce that, but also can we stop it from hallucinating, or can we retrace our steps? As AI becomes part of our diagnostic pathway, where it's starting to give patients, clinicians advice on what to diagnose, that's where it starts to become a little bit of a risky area. Anyway, so I hope you enjoyed this video today, short one on AI in healthcare. Please let me know if you have any kind of thoughts and comments. Yeah, I'd love to hear from you. Thank you for joining me today. Bye.